We're talking about distributive shock. So the first one we're going to talk about is septic shock. And basically, septic shock is that somebody's actually gotten sick, right? They've developed some type of infection, and this is usually a widespread infection. It's into your blood, it's throughout your whole body, and it's usually caused by a bacteria. What happens with that? The triggers because when you get that sick with that level, there's the macro like a microvascular basically vasodilation in your body, which increases more space for the fluid to leak into. Also, the body has trouble controlling the ability to constrict that. Tank of yours, the vascular system, to make it smaller. So basically, these people get severely sick, they get extremely hypertensive, and it takes a lot of work to actually treat them when we're talking about decompensated shock, and they're usually in that stage when you get to them if they're septic. So a lot of times they won't be feeling well for a number of days. It can happen over 24 hours depending on how aggressive the infection is. They usually have fever and chills, and don't be surprised sometimes they don't have a fever. There actually might be a little bit of hypothermic, just or hyperthermic but hypothermic because of the wetness and the sweating, and they just get this really bad chill, and actually they'll get cooled off because the body is having at that point all those blocks are out of place, and the body's having problems maintaining perfusion. So therefore, sometimes they do have trouble staying warm. Typical signs and symptoms of it usually may start with pneumonia. It could be a UTI, like a bladder infection, and another one is meningitis. So just be aware, and when, especially if you got people that are coughing with this type of infection, you don't want it. So make sure you're wearing your PPE. Some ways we can help treat this, again, supportive care. Support and treat what you find, which you normally would. You want to might look at giving some fluid to these people. Just be judicious, because this fluid can also not just leak into the vascular spaces, it will actually leak back into the lungs. They might have signs of crackles or fluid in their lungs. So if you fluid overload them, we're just going to make their lungs worse. So just be aware, just pay attention on how much fluid you're giving them. The other thing too is that as an ACP, we might start some vasodilators, or sorry, vasoconstrictors, right? So we're going to look at like epi or epinephrine or something like that to actually squeeze that tank. We'll actually do the squeezing ourselves. And the biggest thing is you want to look at early transport. If you show up and this person's sick, you want to get them to a hospital and notify the hospital you're coming. So let's talk about this really quickly, and I'll just show you a few things what happens here when we're looking at shock blocks. So before, you can see where the tanks were all, how they're all working, and they're all running into one another, and they're so if it's working properly, we're up here in this area. But what we're looking at now is we're looking at the ability of this block being out of place. So this is what's happening, right? It can't constrict, right? There's a lot of extra space in the body. So what you'll see happen is this is going to ramp up, increase heart rate, increase respiratory rate, right? And this is giving all the signals. You might see an altered LOC that might be a little sleepy, right? They might be struggling to do that. So we're talking before that what we can do is we can start an IV, right? Hang a bag of saline, run it into the tank, and try to bolster that tank. See if we can get that tank a little higher than we need to. By doing that, we can actually block it, maybe. The other option too is if we get enough blood in there, if you're an ACP and you have your ability, that depending on your scope, whether you can give epi or a norepi drip or even dopamine, you might hang in right, a vasoconstrictor, run that in, and when you're running it in, what will happen is we'll actually push that block kind of back into space and actually start maintaining perfusion. But septic shock is very important to understand that they need antibiotics right away. It's important that if they're this sick at this time, you need to notify the hospital you're coming, so when you arrive, they're ready to give them that dose of antibiotics, because that's what's going to make the difference. All right, we'll see you in the next one, which is anaphylaxis.